Hello guys, we have been talking about colon cancer. In this video, I'm going to talk about how colon cancer is diagnosed and how it is treated. So if we have a scenario where we have a patient that has a colonoscopy and the doctor that's doing the colonoscopy finds an abnormal area, they will take a tissue sample. They will send that tissue sample off to another doctor that's called a pathologist. Pathologists are doctors that look at tissue samples under a microscope and they help us determine a diagnosis, and in many cases they also help us determine a treatment plan, primarily because they look at different markers that help us know what kind of medicine would help treat that specific cancer. That's just one of the jobs that they do, but in this case where we're talking about colon cancer, this is the role that the pathologist would play. So once it is confirmed that somebody potentially has colon cancer or likely has colon cancer, the patient's doctor will likely order CT of the chest, abdomen, and pelvis. This is done to see if the cancer has spread further. If it does appear that the cancer has spread further, or there is some uncertainty as to how deep the mass is, the doctor who did the colonoscopy may go back in, may take more samples, or they may send the patient to a surgeon, and the surgeon might decide to take a section of the colon out and do a little bit deeper analysis. So they're going to see how far the cancer has spread in the layer that lines the intestines, and they might look at the lymph nodes, which is the cleaning system that surrounds each organ. If the cancer has spread to a section that is thicker than expected and or the lymph nodes are affected, and on top of that, if there are other organs that have cancer or masses, such as the liver, which is a place where colon cancer commonly spreads, the patient will be sent to a different doctor, which is a cancer specialist, and they will put the pieces of the puzzle together and determine what treatment is appropriate for that patient. If it's a case where the colon cancer has not spread too far, it's just superficial layer of the intestine, in that case, the patient might already be cured when the tissue sample was taken out. In that case, they will still be watched carefully, and oftentimes they'll get a colonoscopy and blood tests every 6 months to 1 year, depending on what their doctor recommends. If the cancer has spread to the deeper layer of the wall of the intestines and or the lymph nodes are affected, on top of surgery, that individual patient would likely get some kind of chemotherapy, which is medicine to kill any leftover cancer. If the individual is in an unfortunate situation where the cancer has spread to another organ, say the liver, which is a common place where colon cancer spreads, the cancer doctor will determine, is this patient a good candidate to just have that section of the liver taken out, that mass taken out, and then they receive chemotherapy and radiation therapy? Or does it appear as if the cancer has spread all over and it's impractical to do additional treatment? If the cancer has spread extensively, it's impractical to do additional treatment. In some cases, the cancer doctor might recommend the patient be transitioned into what we call palliative care, which means that we're focusing on keeping the patient comfortable. In some cases, an individual who is under palliative care might receive some kind of medication. Basically, it's a pill to kind of keep the cancer at bay. The goal is not to cure the cancer, but to keep the patient alive and to extend their life and to help the cancer not grow. In some cases, individuals might, with advanced cancer that spread in many organs, might feel that they don't want to be on pills, they don't want to undergo chemo, they don't want to do additional surgeries, and they just want to let nature take its course and focus on being comfortable. In that case, the individual might be enrolled in what we call hospice, assuming that they have about 6 months or less to live. When an individual is in hospice care, we as their doctors focus on keeping them comfortable. We give them medicines to keep them comfortable. We're not necessarily trying to prolong their life, but we're trying to make sure that they have good quality of life. Despite saying all these things about hospice and palliative care and different stages of colon cancer, a positive thing is that we live in a time and in a place where we can diagnose colon cancer earlier than we used to in the past. And there are many, many, many good treatments in addition to surgery, in addition to chemotherapy and radiation therapy. There are pills that kind of poison the specific cancer cells and don't cause problems in other parts of the body for the most part. That's a generalization. As you guys know, if you guys are physicians, you know about all the side effects that these new immunologics can cause. But many patients are able to take some of these medications that are pills, and they're able to prolong their life, live comfortably, despite having a diagnosis of colon cancer. Up as far as maybe the early 2000s, having these pills was not common. So I found that fairly exciting in terms of progress in cancer treatment. I hope you found my series on colon cancer useful and informative. Bye-bye for now.